My name is Lisa Belmore and I'm a Shiatsu therapist. I'm going to teach you how to do Self-Shiatsu on the hands to improve sleep. Now, when you're applying pressure to these points, you'll be using either the pads of your thumbs or the pads of your index finger to apply pressure. You'll gradually increase the pressure, hold each point for about 3 seconds, and then slowly release. And please keep in mind that the pressure should always be comfortable. So if you're feeling any pain, ease off and use gentler pressure. And if you have any cuts or scrapes, don't work directly over those, but you can certainly work around them. So we'll be doing Shiatsu on 4 rows of 3 points on the back of the hand. And these points lie between the metacarpal bones. Those are the long bones of the hand in here that lead to the fingers. So your first row is between the thumb and index finger. You're going to use your thumb to apply pressure to these points, and you can just rest your fingers on the back of your hand for support. Hold each point for about 3 seconds, and you're always working toward the fingertips. So the second row is in between the metacarpal bones that lead to the index and middle finger. Again, 3 points. The next row in between the middle finger and the ring finger. And then the next row between the ring finger and the pinky. Now, normally you would repeat these points 3 times before moving on to the fingers. So on the fingers, there are points on the front and back and on the sides, and you'll be applying pressure to the front and back or the sides at the same time. So you can use your thumb and your index finger to apply pressure to 3 points on the thumb. The first 2 points are between the first and second joint, and then the third point on the nail bed. And then the same on the sides, so 2 points between the first and second joint, and 1 point on either side of the nail. And on the fingers, because we have an extra joint, we have an extra point as well. So 2 points between the first and second joint, 1 between the second and third, and then 1 on the nail bed. And the same on the sides of the fingers. 2 points, and then 1 point, and then 1 point. And the same with each subsequent finger, so that you're working your way toward the pinky. Again, 2 points between the first 2 joints, 1 point between the second 2 joints, and 1 point on the nail bed. And then on the sides, 2 points between the first 2 joints. One point between the second 2 joints. And 1 point on either side of the nail. And the same for the ring finger. 2 points between the first 2 joints. 1 point between the second 2 joints. And 1 point on the nail bed. And the same on the sides of the finger. Again, 2 points. And then 1 point. And 1. And finally the pinky. 2 points between the first 2 joints. 1 point between the second and third, and 1 point on the nail bed. And the same thing on the sides. And again, you can repeat these points 2 or 3 times if you like before moving on to the next section. So then there are 3 points along the center of the palm, and again using your thumb to apply pressure with your fingers just resting on the back of the hand for support. The first point is just at the heel of the palm. Second point is right in the center. And the third point is just before the knuckles. And then there are 3 points on the thenar eminence. That's the big chunk of muscle that leads to the thumb. Again, you're working your way toward the thumb and using the pad of your thumb to apply pressure. And again, you would repeat those points 2 or 3 times. And then you're going to take the fingers of your right hand, wrap them around the thumb of the left, and give a gentle squeeze, and then follow with a slow stroking motion. And then do that with each finger in succession, working your way toward the pinky. And now you can repeat that with the right hand.